My name is Charles Thompson. I'm a member of Vascular Specialists. I'm a vascular surgeon here in Orlando and Claremont, Florida. I've been a vascular surgeon for approximately 10 years now. I graduated undergraduate school from University of Florida, where I studied engineering and zoology. I then went to University of Miami and obtained my degree in medicine and obtained training in general surgery from Louisiana State University in New Orleans, Louisiana. I then went on to a fellowship at Arizona Heart Institute in Phoenix, Arizona, and then finally a vascular fellowship at LSU again in New Orleans. My wife and I moved to Orlando about 12 years ago, and I joined Vascular Specialists of Central Florida. Since then, I've been treating patients with a variety of vascular diseases. I have interests in aneurysm disease, varicose vein treatment, peripheral vascular diseases, and extracranial cerebrovascular diseases, carotid artery disease. I was instrumental in starting the endovascular program at ORMC and at South Lake Hospitals. I helped write the credentialing and help introduce several techniques into the hospital with regard to endovascular procedures. I have an interest and a background in research and have done some research in the areas of endovascular stent grafting as well. My hobbies are fishing, scuba diving. I have a brother who lives in Colorado. He's my best friend. I spend time with him at least once or twice a year, and we'll do some hiking, camping, or snow skiing in Colorado, or his family will come and see me and we go to the beaches here in Florida. One-dimensional. So all of us who work, everybody who works, they have a family and they have a work life. It is difficult as a surgeon. The two sort of can pull at you from each side. But the first and foremost thing is I have a terrific wife who supports me and really sort of understands what kind of a career this is. I take my daughter every morning to school. I work out in the mornings and then take her every morning in school. And usually morning time is that time, that hour or so that I have with my daughter, kind of getting her ready and getting her off to school. That's the time that we sort of spend together. I have three fantastic partners, and the one thing that we try to do is we try to keep off time sacred with the practice. We do realize that this is not a 9-to-5 job. Our patients need us. They may need us on holidays, they may need us after hours, and we're available for them. Having three other great partners who share the same sort of work ethic and commitment to patient care, I know that when I'm off or when I'm out of town, if one of my patients has a problem, that my partners will take care of them to the utmost of their abilities, and I trust my partners to do so. So in order for us to maintain some sort of outside family life, we've created a practice here where we're all supportive of one another, and I think that this is very much a group and a team effort. Even with regard to our employees here at Vascular Specialists as well, they too have to balance family and work, and we have a commitment towards allowing them to do that as well. You are defined quite often in society by the job that you do, but really who you are is your family and your hobbies and the other things outside of work as well. And it's always a struggle to strike that balance, but I can just say here that in this work environment, as taxing and as difficult as it is to be a surgeon or to work in a surgical practice, we do try to find some sort of balance. I chose vascular surgery and the treatment of vascular diseases as a career. After I'd been in medical school, I decided on the surgical subspecialties, and I found that vascular surgery and vascular diseases had particularly appealed to me for a variety of reasons. First and foremost, had to do with the technological evolution that was going on in vascular surgery. It is a highly technical subspecialty. It involves a lot of devices, it involves a lot of science, and that had an intellectual appeal to me. On a human level, there's a direct interaction that you get with vascular surgery. your patients often have either complicated vascular problems or perhaps not so complicated problems, but they all have issues that affect their quality of life. And the nice thing about this profession is that you're able to take people through all sorts of problems in their lives. It may be life-threatening, it may be a quality of life issue, but you're able to use your skills to directly help them, and you get to see the results of that very clearly. And in a selfish way, it gives me a lot of satisfaction to be able to know that I can help somebody in that manner. And that's the reason why I became a doctor, is really to help people. And this is a really fascinating subspecialty. I really love what I do. And I don't think that I would do anything else. I think I'm kind of cut out for this stuff. But I find myself enjoying what I do more and more as I do the specialty. And I think if I had to do it over again, I'd probably choose vascular surgery again. So in the last 15 years, there's been a rapid evolution of the technology in vascular surgery. There's been a movement really towards less invasive procedures. Formerly in vascular surgery, in order to treat some of these diseases, large operations were required, and it required the patients to spend quite a bit of time in the hospital recovering from their procedures. However, now with catheter-based procedures, we are all often able to do these very same surgeries and procedures on an outpatient basis. Patients are able to return to their normal, active, healthy lives in a much shorter time period. Even so, sometimes those patients even are allowed to be treated here in the office setting and can avoid a hospitalization altogether. And really, this has been great for the patient because this allows them to undergo treatment for their procedure more safely, with less downtime, and the patients are actually more satisfied with this. I joined Vascular Specialists of Central Florida for a couple reasons. The first reason was I was moving back to the state of Florida. I lived in the state of Florida for a while. My father lived in Miami, and I'd gone to University of Florida. And although I went away for training, my wife and I always knew that we would come back to Florida. And in looking for areas to practice, I found Orlando to be, in Central Florida, to be a major metropolitan area that really, at that time, did not have an endovascular program. And this was a very fertile area for us to come and to begin to practice some of the newer techniques in vascular surgery and endovascular surgery. And it required a couple years of collaborating with the hospitals and with the practice in order to set up some of these new techniques and some of these new ways of treating patients. But there was a real need, and I think that we saw that there was a need in Orlando and have been able to fulfill that need over the last 10 years. I think Vascular Specialists of Central Florida stands out when compared to other practices because of our commitment to the individual patient. You know, we realize that being a patient's a little daunting. It's a little scary when you go into a hospital or a doctor's office. Patients often complain that they're sort of shuffled in and out through the system, and it's a very terrifying experience to have to go through a lot of this stuff. But the feedback that I get from our patients, and I think it reinforces our commitment to patient care, is that the patients feel like they're treated more like individuals. They're people who actually care about them. And I think what it brings to light is the overall sentiment at Vascular Specialists of Central Florida. We are here to treat people with diseases. We are here to help people through the whole process. This is a practice and this is a team. All the physicians may be involved in your care as well as all the employees of vascular specialists. And this allows the patient to be treated in what, in my opinion, is a more complete manner. We often assist each other during surgeries. We often look to each other for advice. And even in the hospital, during hospital rounds, we often round on each other's patients. This ensures that the patient gets the most complete care and allows the patient to be given more complete care than what a solo physician can do. The time constraints on surgery and taking care of patients can really be taxing for an individual. Yet when you have the assistance of ancillary care personnel nurse practitioners here in the office and in the hospital, and the employees in our office as well as other physicians, it ensures that the patients get the safest and best care that they can get.